Thank you for that wonderful discussion about how representation in the media impacts mental health. Staying with the topic of mental health, we will be discussing how culture and cultural representation affect the diagnosis and treatment of mental health conditions. Our discussion will be split by conditions. We will talk about autism, ADHD, depression, and anxiety, and eating disorders. Everyone has a unique identity shaped by many factors. Some of these factors include culture, beliefs, personal experience, values, along with many others. These factors also shape how we perceive the world. Because disorders like autism, ADHD, anxiety, and depression, and eating disorders contribute to our personal experience, they also contribute to our perception. That being said, it is important to understand these disorders and how they interact with our culture, which is another piece of what shapes our unique identities and perceptions. Different cultures have different ways of treating mental health disorders and even view these disorders quite differently. Some cultures are more open and accepting of these conditions and talk about them with more openness, while in other cultures there is more stigma and talking about mental health conditions is less common. Differences in culture can also cause variations in how symptoms are experienced or expressed. Improving knowledge about these differences can lower rates of misdiagnosis. Knowing the effect culture and cultural representation has in this area is important for both patients and medical providers. Improving cultural competence in healthcare can lead to more individual and beneficial diagnosis and treatment plan. Now, to start off with our conversation, Vivian will discuss how culture affects anxiety and depression.
Thank you, Taylor, for introducing our topic. Different cultures around the world have different ways of handling mental illnesses like anxiety and depression. Some cultures view anxiety and depression with more openness and acceptance, while many others tend to conceal or ignore mental health illnesses due to stigma and the fact that they can be seen as abnormal. In some cultures, speaking out about mental health issues can be seen as a source of weakness, but a strength in others. The term normal itself is broad and very subjective. What might be considered normal to one culture could be vastly different from another. This raises an important question. Why do we try to fit people into a very narrow definition of what normal is? Mental illness is one thing that is often considered abnormal and presents a challenge regarding being viewed or wanting to be viewed as normal. Many ethnic groups and immigrants do not have as many accessible resources due to cost of treatment, language barriers, and extra attention and stigma that comes with having mental health disorders. Studies have shown that 63.7% of Latinos, 68.7% of Asians, 58.8% of non-Hispanic Blacks, and 40.2% of non-Hispanic whites failed to access treatment services. These statistics demonstrate that white individuals are more likely to receive mental health services compared to individuals in minority groups. Moreover, disparities in quality of and access to care are prevalent among different racial groups. Asian Americans and non-Hispanic Blacks often encounter greater obstacles compared to their non-Hispanic white counterparts. One contributing factor is the education and training of healthcare professionals regarding mental health. Many practitioners may not receive adequate training to address the unique cultural and social context of their patients, leading to gaps in understanding and treatment. Many people have specific doctors they tend to go to, from family doctors to different types of specialists. This is partially due to insurance coverage, but can also be a matter of preference, previous experience, and other factors. This plays a huge role in how people receive treatment for their health conditions, and mental health treatment is no different. Some medical professionals prefer to treat mental health conditions without prescription medication and instead turn their patients to counseling or other treatment methods. Some doctors may only treat conditions like anxiety with prescriptions, while others use multiple treatment options such as medication and counseling combined. Because our culture is a significant part of what shapes our perception and how we experience life, it also contributes to how we experience mental health and conditions like anxiety and depression. Unfortunately, due to the lack of cultural representation in the medical field and the area of mental health specifically, many patients do not receive care that would be most productive and helpful to them. Part of this is due to the fact that healthcare professionals do not have a complete knowledge of how to change their treatment options and plans based on a person's culture and unique experience. This leaves many gaps in knowledge about all types of mental health disorders, not just anxiety and depression. In many cultures, social norms dictate how mental health is viewed and treated. Stigma surrounding anxiety and depression can prevent individuals from receiving or asking for help. Additionally, health professionals in these cultures may not have all of the knowledge or resources necessary for treating patients with anxiety and depression. To address these issues, it is important to challenge the stigma around anxiety and depression. It is also important to limit other factors contributing to low treatment rates, such as language barriers and cost of care. Mental health treatment, counseling, and prescription costs can be very expensive, leading to individuals not receiving the help they need. Treatment can also be improved by better training healthcare professionals to understand and respect patients' diverse backgrounds and cultures and create a treatment plan accordingly. All of these things can be done to help bridge the gap for underserved populations. Now we will go to Karime to speak on ADHD and autism.
Sarah had more typical ASD first concerns for Gabriela, such as playing alone, difficulty with transitions, but as Gabriela developed more skills, Sarah's denial grew. She said she's able to communicate with others, she's able to play around with other children, she's able to tell me her needs, so to me it's like, no, she's not autistic. Low quality of life, cultural norms, and the gap between cultural communication practices and the standards approaches in medical environments contribute to the low levels of ADHD and ASD diagnoses in people of color. ASD stands for Autism Spectrum Disorder and is defined by the Center for Disease Control as a developmental disability caused by differences in the brain. ADHD stands for Attention Deficit Hyperactivity Disorder and is defined as one of the most common neurodevelopmental disorders of childhood. Neurodevelopmental disorders like ASD and ADHD are typically diagnosed in childhood, but the effects of the disorder can continue until adulthood. The National Center for Health Statistics produced research based on ADHD diagnoses from 2020 to 2022. Their key findings include the prevalence of ever diagnosed ADHD disorder was 11.3% in children ages 5 to 15 years old, with boys having a higher prevalence than girls. White non-Hispanic children ages 5 to 17 years old were more likely to have ADHD than Black non-Hispanic and Hispanic children. The prevalence of ADHD has decreased as the level of family income increased, and children with public or private health insurance were more likely to have ADHD than children without insurance. Low quality of life, cultural norms, and gaps between cultural communication practices and approaches in medical environments contribute to these low levels of ADHD and ASD diagnoses in people of color. Due to the long-term effects of historical systems of oppression, people of color tend to be more socioeconomically disadvantaged, have lower educational levels, work in dangerous places, and are less likely to have health insurance. Because of intergenerational trauma in many minority spaces, emotions and mental health are taboo. Parents are often discouraged by their families to report or worry about symptoms. Communication plays a deep role in the lower diagnosis of people of color, as people of color have distrust in the medical system due to historical racism, bad personal experiences, or for immigrants, the inability to communicate in their language. Low quality of life. In the state of Texas, more than 14 million people, including 623,000 children, are uninsured. The group of people most affected are Latinos, people in families with incomes 200% below the poverty level. Latinos make up 13% of the U.S. population and 25% of those Americans without health insurance. Without health insurance, families lack the resources to address concerns, but they also do not have access to education to identify symptoms or concerns of ASD and ADHD. If concerns are present, families carry huge financial burdens of choosing to pay out of pocket or not addressing the concerns at all. It is incredibly important for ASD and ADHD to be addressed and treated at a young age for them to be effectively managed, as consequences can lead to depression or other severe mental health disorders. This dynamic continues to contribute to the larger discrepancies that people of color face in the healthcare system. Cultural norms. The American healthcare system and research on medical and psychological disorders have historically centered around European men. In recent years, scholars have agreed that discrepancies in knowledge due to research around men has led to women being diagnosed less with neurodevelopmental disorders. For example, males with ADHD begin to show symptoms at a very young age, but research is beginning to show that females have onset symptoms at an older age. Racial and ethnic differences add another complex layer. Through cultural norms, families of color, particularly Latino families, are more likely to live in multi-generational households. This leads to grandparents disagreeing with the diagnosis or being unsupportive to parents seeking to diagnose their children. From my personal experience as a daughter of Mexican immigrants, I can say that mental health care is not the norm in Latino households, and disagreeing with that can lead to being an outcast or being looked down on. Language barriers. In communities of color, especially among non-English speaking families, language challenges can seriously impede the diagnosis of attention deficit hyperactivity disorder and autism spectrum disorder. Due to systemic disadvantages, navigating the healthcare system is already tough for Black, Latino, and immigrant families. Language adds another level of complexity. Important details regarding a child's growth may be overlooked, misunderstood, or never communicated when medical personnel are unable to interact with parents or other caregivers in their mother tongue. Consequently, early indicators of autism or ADHD, which depend on in-depth behavior descriptions, might be missed or misinterpreted. Parents in Latino communities where Spanish is frequently the first language spoken or the only language spoken may find it difficult to communicate their children's developmental difficulties or to pose crucial questions because of this. Studies have shown that Latino and Black children are diagnosed with ASD and ADHD later than their white counterparts, which suggests that language and cultural factors play a significant role. Delayed diagnosis can result in fewer years of intervention, widening the gap in educational and social outcomes for children of color. Cultural norms and biases influence the way autism and ADHD are diagnosed and understood, but they also play a significant role in the recognition and treatment of eating disorders. The historic re-entrenchment of minority groups, social norms, and changing cultures can also contribute to eating disorders. Let's explore how these cultural factors contribute to the growing issue of eating disorders and how culture affects its diagnosis and treatment with Sophia. Thank you.
Thank you, Karime, for that wonderful discussion about how cultures can affect the diagnosis and treatment of individuals with ADHD and autism. Like she said, I am going to continue to discuss culture affecting mental health, or more specifically, the mental health of eating disorders. Different cultures affect the way people view their eating habits, and because of this, causes people to suffer mental disorders such as eating disorders. In Western countries like America and the UK, eating disorders are a major cause of death compared to other mental illnesses. Unlike America and Western countries, eating disorders are not a major cause of death compared to other mental illnesses in non-Western countries, but one reason why that is because it is not viewed as a mental illness. Eating disorders are not talked about in other cultures as a thing that has an effect on individuals' minds and is considered normal. Eating disorders can stem from cultures, but also the location of the different cultural groups. The research of eating disorders is based upon old data collected from white Eurocentric men, and with data from that is used for everyone else when diagnosing and treating individuals, even if the individual they are diagnosing is not white or a male. Every ethnic group perceives eating disorders differently and has different experiences with eating disorders, so the study of white males cannot be used for other cultural groups as it is inaccurate to them. Eating disorders can pertain to not eating, but it can also be overeating as well. There have been multiple studies made on how different cultures are affected by eating disorders. One study discusses how culture clashing of South Asian women living in the UK causes them to obtain eating disorders. Another study shows how different ethnocentric groups living in Israel all have different eating habits, and therefore shows how their habits contribute to their own cultural eating disorder. Both show different ways that culture affects the mental health, more specifically, eating disorders. In the study pertaining to the South Asian females in the UK, it discusses how the South Asian culture combats with the British culture. They both have different ways of eating and perceiving things about food, but due to the westernization, a lot of female South Asians that are living in the UK have an eating disorder, whether it is bulimia or anorexia or other types. In the other study discussing how different cultural groups living near one another in Israel all have different characteristics when it comes to eating, and eating disorders show that each group's culture plays a significant role in the way that they should be diagnosed and treated, since they are so different but have similar characteristics as well. It discusses how Jews living in Israel differ from Arab Christians and Arab Muslims that live in Israel. In the study that the researchers found some data with their eating behaviors that was prevalent in all three groups, and some that was only in one group compared to the others. They all live in the same country, but due to their individual belief sets, they will eat certain foods that another group will not eat, or can eat an excess of one type of food based on that belief. I will now send it back to Karime for our conclusion.
Mental health is a very broad spectrum with many different types of diagnoses and treatments, and it is important to understand different things that can impact it. One of these things that affects the way people are diagnosed and treated is their culture. Many cultures aren't represented in studies made to help diagnose and treat people with mental health disorders. It is important to go further with testing and experiments so that more people can understand their mental health better. Our systems of mental health care are historically Eurocentric and limited in scope. Research suggests that cultural factors like norms, traditions, socioeconomic status, and surrounding environment negatively impact the experiences of ethnic minorities in their mental health care and diagnosis experience. Different cultures experience things differently from one another, and it needs to be understood that they have to be diagnosed and treated in the best way that's not only from studies conducted on white men. From lack of health insurance to language barriers, people of color and ethnic minorities experience mental health care differently than white people. Our mental health care system should be reconstructed toward a holistic approach, looking at individuals versus generalizations, and expanded scope to provide better experiences for all people. By improving representation in the diagnosis and treatment of mental health disorders, we can create a system that truly helps everyone. This is important because there are so many cultures in our society, and it is not only important to address that, but also to use treatments that will work for the individual struggling. Representation is vital for the improvement and betterment of mental health care systems. Not only is mental health influenced by representation, but the importance of representation extends to physical health as well, in mental health diagnoses and media alike. Thank you for your attention and engagement throughout this episode and the overall podcast. The following episode will deep dive into the importance of media representation on body image and physical health and its contributions to wellness and representation as a whole. Thank you.